Hello everyone, this is Dr. Nyla Fleming, and this is a very quick review of module number 2. This module focuses heavily on prevention. It will cover elimination, feeding patterns, obesity. Make sure that you take the time to review all of the module. The things that I'm presenting here are things just to kind of get you guys jump started. It's not meant to be exhaustive, and it's definitely not very detailed. I just want to jumpstart your learning. So the first slide is a slide about prevention. I can bet you money that you will see questions about prevention on your future board examinations. Be sure that you know the difference between primary, secondary, and tertiary prevention. A primary intervention is something that is done before a problem occurs. So an example of primary would be vaccines, which we are covering this module. Secondary prevention is early detection or screening tests. So think about things like mammograms, pap smears. Those would fall into secondary. And finally, there is tertiary prevention. And this is the patient already has the disease or the condition, and we as providers work to slow the progression or prevent further damage. An example of this would be chemotherapy. The next topic is breastfeeding. This is covered pretty heavily throughout this module. It's important that you know the current recommendations for breastfeeding. The recommendations are that an infant is exclusively breastfed for the first 6 months of life, and after that 6-month period, and we're introducing foods to the infant, the child should still be breastfed through the first year. So from 6 months to 12 months, it's a combination of food plus breast milk. There are numerous benefits associated with breastfeeding. Breast milk provides an excellent source of vitamins, minerals, and antibodies for the child. Breast milk also has the ability to adapt to the needs of the child. Children that are breastfed have lower risk of obesity, which is what we're also covering in this module. So that is one of those things that I don't want you to forget, is how important breastfeeding can be for the risk of obesity. Children that are breastfed also have lower risk of asthma, ear infection, sudden infant death syndrome. So there's some pretty significant health benefits for the child. As far as the benefits for the mom, it helps the mom return to her pre-pregnancy state much faster. It helps establish the bond between the mother and the child. It also decreases the risk of breast and ovarian cancer in moms who have breastfed. There are instances when breastfeeding is contraindicated. It's not typically something that we think about right away, but as clinicians, this is information that we are expected to know. Examples of when we would not recommend breastfeeding or when it is contraindicated would be if mom has HIV infection, if mom has herpetic lesions on her nipples, or if mom is an active drug user such as cocaine or PCP. Those would be reasons why we would not recommend breastfeeding. As we all know, America has a problem with obesity. So as clinicians, we will need to teach our patients and their families about healthy meal planning, healthy diets. I encourage you all to go to myplate.gov and take a look at the recommendations of a healthy meal and also other reasons why people may struggle with finding adequate nutrition. Please take the time to familiarize yourself with risk factors for obesity. We are covering it pretty well with this current module, but you should all have walking around knowledge, which means that is information that you should be able to quickly recall for potential risk factors for obesity. As future clinicians, we should always screen our patients and their families for these risk factors. Anticipate answering a lot of questions for parents about the elimination patterns in infants. As a future clinician, you should know that bowel patterns are related to the frequency and the amount of feeding. There will be a difference between bowels of breastfed infants compared to formula fed infants. For instance, the appearance of the stool in a breastfed infant will differ than a child that is being fed with formula. Breastfed infant stools have a tendency to be softer, sticky, and a light yellow. Infants that are formula fed, their stools may be firmer, darker, brown, greenish, or even dark yellow. As far as urination goes, this will be affected by the amount of fluid that a child intakes, but at minimum, you should expect at least 6 wet diapers per day. And parents are going to have questions about when will my child be able to control their bladder. The answer to that is voluntary bladder and bowel control starts around the age of 12 to 18 months. So be prepared to answer that question specifically to your parents because they're going to ask. Be prepared to answer questions on toilet training. You are now the expert, and parents will look to you for your advice. Children will not typically be ready for potty training before the age of 12 months. Anticipate that the physiologic readiness will happen by the age of 18 months, and most children will be potty trained by age 4. There is an order of elimination control. The order is listed here, so children are able to control their bowels at night, then bowels in the day, then bladder in the day, and then finally bladder at bedtime.